Hi folks, this is John Adamson, the Rehab and Documentation Guru. Today asking you if you remember your end feels. So when we do range of motion measurements, we're talking about the quantity, the amount of motion. But end feel has to do with the quality, how it feels. And there are 5 different end feels. So when we are assessing range of motion, one of the things that we should do that is skilled is not just get the measurement, which does take some skill because you have to know how to do anatomical reference points to do it properly, effectively, but we should also be getting the quality because that tells us a little bit about whether we have a normal range of motion or we have a pathological range of motion. So you might remember them, and I'm going to do them in no particular order, but we have hard end feel, which is of course bony approximation. We get that generally with things like elbow extension, where the quality is a solid block. We also have firm end feel, and this is a stretch. We can get stretches from things like capsular pattern, from ligamentous stretch, from muscular stretch, and they might have a little bit different excuse me, quality to them, but they are still firm end feels. Then we have soft tissue approximation. Not a lot of that going on in the body, but for example, elbow flexion should have the quality of basically just you bending somebody's elbow and you abut the forearm to the biceps, and that's as far as you're going to go. It's blocked. So we've got soft tissue approximation. Then we have springy end feel, and this is something I've sometimes forgotten to pay attention to, but I have a daughter right now who has what I think is a springy end feel to her elbow flexion. She's actually getting PT, not from me because I'm dad, not her therapist. Anyway, she's got what appears to be some kind of soft tissue, like a cartilaginous block in the joint, and so we're getting an MRI. Great fun. So hopefully she does not need to have surgery to her elbow to fix that. But anyway, springy, where you have a block in the joint of usually meniscus in the knee or something like that, where you're getting a little bit of a boing, 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 sensation to it. So we've got springy end feel. What's next? We have empty end feel. So this is where you can't feel a restriction. The quality on your side is you feel plenty of give. You should be able to keep going, but the patient tells you to stop, and this is because of pain. So this is empty end feel. And knowing what each joint and each motion should have, not only for range of motion, but also quality of motion, really tells you a little bit of something about what's going on with the patient. And all clinicians that assess range should know not only the range of motion measurements that that joint is capable of, that will be the quantity, but also the quality of the end feel. Because if you get an abnormal end feel, or you get an end feel well before the effective range of motion of that joint, that's a pathological restriction of the range, and we should be documenting that. And that's partly where your skill comes in and proves that you are medically necessary to address the issue. Anyway, John Adamson, the Rehab and Documentation Guru, wishing you a pleasant day. Take care and God bless.